We are discussing live now with Dr. Debashish Roy. The topic of discussion, obesity, what it means to have a high BMI. Dr. Roy, if you could please brief our audience on the topic today.
Good afternoon. Today's topic is on obesity, and the program is essentially divided into two parts. One is to highlight the actual problem, and secondly is to find a solution to the problem that is relevant and that is easily understandable by the population.
Sir, the first question that comes to mind regarding the topic is what do we mean by BMI?
Okay. BMI basically stands for Body Mass Index, and it's a ratio wherein we divide the weight in kilogram by the height in meter. So it is kilogram by meter square.
Okay. And how is the weight classified according to BMI?
Okay. Now the WHO classification states that anybody whose BMI is between 18.5 and 25 is normal weight. Between 25 and 30 is overweight, and above 30 is obesity. It is further subdivided into class 1, class 2, class 3, depending upon the actual weight. And on a rough scale, anybody who has a BMI more than 35 is called excessively obese. More than 40 is morbidly obese, and more than 50 is super obese. However, there is a slight variation with the Asian population, particularly the Indian subpopulation, wherein two sets of things happen. One is that most Indians have more fat relative to their weight, and secondly, comorbid diseases like diabetes happens at lower BMI in the Indian population. And hence, for the Indian population, the classification is anybody between 18.5 and 23 is normal weight, 23 to 25 is overweight, and more than 25 BMI is classified as obesity by Indian standards.
Right. So, Indians are generally very fond of food. So, does food intake affect weight?
Yes, certainly it does. Now, the problem with food intake is that overeating causes weight gain at a very slow rate, approximately less than half a kilo per year. So, it is extremely difficult for somebody to recognize that that person is gaining weight till over several years it becomes then a significant problem. That's number one. Number two problem is that the simplest way of understanding it is that if the calorie intake exceeds the calorie burnt, you will put on weight. Similarly, if the calorie intake is less than the amount of calorie burnt, you lose weight. And if they are same, you remain static. That's very simple to understand. What is more difficult to understand is the type of calories are also very important. Let's take some examples. When we talk of fat intake, now we know that fats are different types. We have trans fats, we have saturated fats, we have monounsaturated fats, we have polyunsaturated fats. Now, trans fats and saturated fats, and I can give you some examples, like baked foods, like cakes and cookies. Then you have whole milk, you have butter, ice cream, coconut oil, fried foods, fried chicken, donuts. These are bad for you. Whereas when it comes to monounsaturated or polyunsaturated fats, for example, olive oil, soybean oil, sunflower oil, these are actually not bad, and you can take them, but you should not see any weight gain. Secondly, proteins. Protein sources are again good or bad. The good proteins are those that are derived from nuts, beans, fish, poultry. When it comes to carbohydrates, white flour, white bread, white rice, potatoes, breakfast cereals are bad for you, and including sugary drinks. Whereas if you take brown rice, barleys, oats, these are good sources of carbohydrates.
So, you've busted a few myths as well. So now the biggest myth that our audience feels is that dieting can actually help in weight loss. So, what do you think is the role of exercise in weight
Yeah,
loss?
I think that is the second most important point. Just dieting can help, but dieting with exercise certainly helps much more. And when we talk of exercise, we are not trying to tell you to go to the gym and work out in an organized way. What are the fundamental things about exercise? One is the exercise should be aerobic exercises. Examples of aerobic exercises: walking, jogging, cycling, dancing, treadmill, swimming. And how much should you do it? I think the recommendation is 3 times a week and 20 minutes per session. But there are certain myths. If you do not have to do this entire exercise in one session. You can divide it throughout the day. For example, if you take the stairs instead of the lift, that is good exercise. If you park your car slightly farther away from your destination and then walk the distance, that is good exercise. If you walk to work or cycle to work instead of taking transport like cars or buses, that is good exercise. And another simple thing is, if one walks, say 15 minutes, approximately a mile, the person will burn up 100 calories. And if you can burn up 700 calories a week, that will translate to a weight loss of more than 4.5 kilos in a year.
That is very interesting. So, we've discussed food, we've discussed exercise. What else can help us in losing weight?
Well, there are several other factors. Among them, genetic factors, environmental factors, stress factors are also very important. Several genes have been implicated in the weight loss. It is sufficient to say that if a person has both parents overweight, the chance of that person becoming overweight is more than 80%. But more importantly, a genetically predisposed person finds it extremely difficult to lose weight by diet control and exercise. And even if they can manage to lose the weight, it is very difficult for them to maintain it. And these are the people that more frequently require medical management or surgical management. Now, coming to environmental factors, it is again well known that babies born to mothers who have been smoking during pregnancy tend to be overweight. Babies who have been breastfed for less than 3 months after birth tend to be overweight. Babies born to mothers who are diabetic tend to be overweight. And as a child, if you spend time watching television, playing video games, you tend to develop a sedentary lifestyle as an adult, and that also encourages weight gain. As far as stress is concerned, we all know that suffering from depression, suffering from anxiety, any other emotional disorders tends to make us eat more and therefore gain weight. Lack of sleep disrupts the hormonal balance that determines hunger and satiety, and lack of sleep is also known to cause weight gain.
Are there any diseases that can cause weight gain?
Yes, certainly. A few of the diseases that comes to mind, one is hypothyroidism, where the thyroid gland is underactive. This slows the metabolic rate in the body and tends to cause weight gain. Secondly, people who require insulin for diabetes control tend to gain weight. Thirdly, aging. Aging causes loss of muscle mass as a result of reduced activity. Muscle is a good calorie burner. So if, as we age, we continue to eat and drink as much as before without adequate activity, it actually promotes weight gain. Fluid retention from cardiac diseases, from liver problems, from renal problems causes water accumulation in the body and weight gain. Steroids, either taken for treatment of, say, asthma or arthritis, causes increased appetite and weight gain, or certain diseases, certain tumors can cause excessive steroid production in the body. A condition called Cushing syndrome can cause weight gain. And finally, a very common condition is polycystic ovary disease, PCOD. PCOD causes weight gain along with problems of infertility, menstrual disorders, excessive facial hair. We don't know exactly why people gain weight with PCOD. However, increased levels of insulin and testosterone has been implicated as the reason for the weight gain.
So the next question that comes to our mind is, what are the side effects of obesity, since it's such a big problem, especially with the Asian population?
Yeah. I think before we talk of disease, I think even those people who do not have any actual disease resulting from obesity, they suffer from a lack of, it's like a social stigma. They have this feeling of insecurity, feeling of shame, and the social stigma associated with it stops them from going out, stops them from meeting people, stops them from doing things because they're overweight and they think that people are sniggering behind their backs. Besides this, they have a lot of pains, aches and pains all over the body. They are slow, they cannot keep up with their peers. This is a huge problem. Now, if you come to the diseases, there is a triad of diseases which includes diabetes, which includes high blood pressure, which includes high cholesterol or triglyceride. These three things together are almost always seen in obese people. And this leads on to an increased incidence of heart attacks, increased incidence of stroke. They also have breathing problems, sleep apnea, osteoarthritis, which causes pain in the joints, and they have mental disorders. Mental disorders in the sense of depression, anxiety. And overall, the mortality rate is much higher among people with obesity compared to normal weight people.
Are there any medicines which can help reduce weight? Because people always have the first point that they say is they do not have time for exercise.
Correct.
So they look for options, they look for shortcuts. So are there any medicines which help reduce weight?
Certainly there are medicines, but your question makes me answer the first point, which is medicine is not an alternative to exercise and good dietary habit. And this has to be very, very clear. Medicines are there. Medicines are indicated for people who are obese and people who are overweight, along with other comorbidities such as diabetes and hypertension and hypercholesterol and hypertriglycerides. However, again, I must reiterate that medicines is not an alternative. They have to be taken along with dietary restriction and exercises. And it has been found that people who take medicines along with dietary restriction and exercises lose 3 to 9% more weight than people who just are on exercises and healthy eating. Now, there are different types of medicines which are available in the market, but please note that they all have significant side effects. The commonest medicine that is used is Orlistat. It is approved for use in adults, and it is also approved for use in children more than 12 years of age. It works by reducing fat absorption from the intestines. However, the side effects of Orlistat are diarrhea, bloating, and fat-soluble vitamin deficiency. There are other medicines which decrease hunger and increase satiety. Examples is a combination of phentermine topiramate. However, phentermine topiramate is contraindicated in pregnant patients, people who are planning pregnancy, and people who are breastfeeding. There is another combination medicine called naltrexone bupropion. However, it has significant side effect of causing hypertension and more worryingly suicidal tendencies. And finally, there is an injection called liraglutide, but again, it comes with a serious side effect of acute pancreatitis.
Right. There is also the possibility of surgery for weight loss. So when is this surgery advised for weight loss, and how does it work?
Well, surgery, to keep it simple, is advised for people with BMI more than 40. It is also advised for people with BMIs between 35 and 40 who have the other comorbidities such as hypertension, hypercholesterol, and diabetes. And finally, it is also advised for people with a BMI of 30 to 35 with uncontrolled diabetes. Now, as I told you right at the beginning, the Indian subpopulation tend to show disease at a lower BMI. So for the Indian subpopulation, this international indication is much more relaxed, and the Indian subpopulation surgery is advised at a much lower BMI, especially if they have significant comorbid disease. The other myth that goes on about surgery is that it should not be done for young people and it should not be done for the elderly. But now there is enough evidence to show that surgery is beneficial for those below the age of 18, those above the age of 60. Now, how does surgery work? There are different types of operations that are in vogue. However, to put it simply, surgery works in two ways. One is called restrictive and the other is called malabsorptive. By restrictive, it means that the amount of food that can be taken is restricted by reducing the size of the stomach. So, as soon as you start eating, you feel full because the lower volume of the stomach can accommodate only that much food. So, you feel full, you feel that you're not hungry anymore, and you stop eating. That is how the restrictive surgeries work. Now, often for people who are, say, morbidly obese or super obese, restrictive surgery is also combined with malabsorptive surgery. And in malabsorptive surgery, the additional benefit is that the food that we take in is not digested and absorbed entirely. So a part of the food just passes through without digestion and absorption. Hence, the intake of the fat, intake of the carbohydrate, intake of the protein from the same amount or same volume of food is lower than if you did not have the malabsorptive procedure. So this is essentially the gist of how bariatric surgery or obesity surgery works.
Are there any problems which may occur after the surgery?
Yes. There are certain problems that occur and there are certain dietary restrictions that have to be followed after bariatric surgery. To put it in a nutshell, the commonest symptom after bariatric surgery is called the dumping syndrome. And dumping syndrome essentially relates to a feeling of nausea and dizziness after food. Secondly, there is a significant risk of vomiting if the patient overeats because the stomach is now smaller than normal. They may develop malnutrition problems, particularly with the malabsorptive surgeries. So they then develop deficiencies of vitamins and minerals and essential nutrients. However, these can be supplemented. Fourthly, they can develop low blood sugars, again, essentially because of low carbohydrate, but that actually can be a benefit because most people, the requirements for anti-diabetic medicines become drastically reduced. And rare side effects may be stomach ulcers, intestinal obstruction, hernias, because it's an operation done on obese people whose healing capacity is reduced. More importantly, the patient has to follow a strict diet regime after the bariatric surgery. And essentially, this means they should avoid bread, they should avoid fizzy drinks, they should avoid raw vegetables, even some high fiber vegetables like cauliflower and broccoli, corn, celery. Raw meats should be avoided along with fried foods and spicy foods, and certainly no nuts or seeds and even popcorn.
So we've had an amazing discussion, and as we come to the end of this session, I'm sure our audience would like a few words of wisdom for them for how to lead a lifestyle that would help them avoid obesity, and how to avoid certain foods which they love, and are there any alternatives which are possible?
I think essentially, if today a patient is diabetic and goes to a specialist, the essential advice now is that it's not like you can't have this, you can't have that. The importance is the calorie intake. So, for example, if we Bengalis love mangoes, but mango unfortunately has a huge, very, very high calorie content. Now, it does not mean that you should not have mango. The question is that if you have a mango, you need to cut down on the rest of the calories you consume in the rest of the day, and you can still have a mango. So nobody is telling you that you should not eat that, you should not eat this, but you should watch the total calorie intake and make sure that you have burnt the same amount or more to maintain a steady weight.
Thank you, sir. I'm sure we'll have more questions and we'll guide them to you, and hope to connect with you really soon again.
Thank you.